So, despite the history and unfortunate stigma that many people in the healthcare community, specifically physicians, may have when viewed by the Black American community, it's still extremely important that Black Americans get screened for lung cancer to hopefully decrease their risk and identify any disease that's identified or that may be picked up on the CAT scan that wouldn't have been seen otherwise. So in terms of figuring out who should be screened, there are set criteria that are currently used by physicians to decide who is technically at a high risk for lung cancer. Some of those things are being between the ages of 50 and 80, being a current smoker or having quit smoking less than 15 years ago, having smoked a pack a day for 20 years or 2 packs a day for 10 years or more, and not relying on the presence or absence of symptoms, because a lot of times patients who have early stage disease are not going to have symptoms. But if you do have symptoms, they may be suggested that you need to be screened. And some of those symptoms to consider are a cough that doesn't go away, chest pain or shortness of breath, losing weight unexpectedly, coughing up blood, and having symptoms of fatigue that seem to persist even if you're not, you don't have a reason to be tired. People who are eligible should be screened once a year. And again, this is something that your primary care physician would help coordinate, or even a pulmonologist, a lung doctor that you might be seeing for some other reason. For people who don't fit into this screening criteria, it's important that, one, you're aware that screening is something you should consider. And if you think you might be high risk based on maybe a job that you've had where you've been exposed to a lot of toxins, or if you started smoking at an early age, if you were exposed to a lot of secondhand smoke, or if you were a veteran and you served in, a location where you think that you might have been exposed to toxins that might harm your lungs, these would all be things that you should consider talking to your primary care doctor about. And even if you don't fit directly into the screening criteria, you should consider asking them to have you undergo a CT scan. Just to summarize, the actual formal criteria for whether or not somebody should be screened for lung cancer are that the patient is between the ages of 50 and 80, that they're a current smoker or quit smoking less than 15 years ago, and that they've smoked a pack a day for 20 years or 2 packs a day for 10 years. If anyone or a patient fits into any of these 3 criteria, then they would be eligible for lung cancer screening with a CAT scan.